Hello everybody, and welcome back to another episode of Outcomes Rocket. I'm so excited to be here at HIMSS 2024 with two outstanding guests. I want to welcome back Dr. Neechi Mosha, Senior Vice President of Growth at Clarify Health, as well as his colleague John Barzydlo, Vice President of Customer Success at Clarify, to a special edition of this Healthcare Unbound series at HIMSS 2024. First off, I want to say congratulations to both of you and the Clarify Health organization for winning the Best in Class for Healthcare Analytics for Payers. A big accomplishment. And what does that mean for Clarify Health? We'll start with you, John.
Yeah, so it's a massive accomplishment, testament to our customers more so than anything else. We work with them on a regular basis to try to drive improvements in quality, reduction in cost, and we feel like we're making headway there, and it's nice to be recognized to do so. Our entire mission is focused on trying to improve the healthcare ecosystem, so anything that we can do to get there is fantastic, and the fact that our customers are seeing the value from our platform, from our analytics, is really reinvigorating in the industry, right? Healthcare costs keep going up, prices are more expensive for everyone. The fact that we're making a little bit of a dent in that, we're helping the healthcare ecosystem improve, is massive, and we couldn't do that without our customers, but it's a huge award and we're really excited.
Congratulations, it's a big deal.
Yeah, no, it's really exciting to hear it from a third party too. It's one thing to speak to our customers and hear from them firsthand. It's another thing for us to spend all day talking with our product teams and our customer teams around how we can improve. Yeah. But to get a third party to have that level of recognition for us is really amazing. And yes, the award was for the payer solutions in particular, but it's the same common platform across everything that we do at Clarify. Yeah. So it's really a recognition of just the entire tool that's been built and the platform we built. So we're excited.
Yeah, well, congratulations. And by the way, folks, for anybody curious about the platform, we'll link it up in the show notes to make sure you can take advantage of the platform for your organization. The other news is that Clarify has a new claims data partner, giving you all one of the largest claims data sets in the country. Neechi, how did this come about?
Yeah, gosh, we for the past 6-7 years have been building what we wanted to be the largest healthcare data set. And we finally can say that out loud, which is amazing now that we've brought on this new partner. And this new partner brings in additional sources that we've not historically had. And now we can leverage all of that information to provide the best insights to feed into the platform that John was talking about that Class has just provided us the recognition against. But we can start to uncover new areas where we can enable providers or where we can assess provider performance in ways that we're able to just stitch together this longer longitudinal journey against care that's being done. That's really the crux of it for us, is how do we get as much information so that we can stitch together the longest journey and provide insights based on that.
Well, definitely lots of insights, lots of news with you guys, especially at this conference. And so how will you leverage this claims data assets? Like it's a big deal. How do you plan on leveraging it?
Yeah, in a variety of different ways. So first and foremost, as Neechi mentioned, it will stitch together our patient journey logic. So our ability to understand what a patient is going through throughout their entire healthcare journey, from diagnosis through treatment. We'll have a better understanding of that so we can better treat that patient, work with clinicians to provide better care. Secondly, it'll allow us to understand the market dynamics a lot better, right? We're gonna have much more signal in a given market, which will allow for us to pinpoint the specific opportunities for a hospital or a health plan to drive performance improvement on their side as well. So there's a myriad of applications that we're gonna drive it towards, but it's really focused first and foremost on the patient, improving their care, and then secondly, the market dynamics and how we can help organizations increase their footprint throughout their given market or their given area of focus.
Thank you for that.
Yeah, no, it's exactly what John said. And I think we can start to also talk about who else in the ecosystem can we start working with now. And we've always historically worked with health systems and health plans, but we'd like to start working with more and more digital health companies that are out here at HIMSS, and we can start to inform how they're thinking about things. We can also talk to benefit consultants who work with employers really closely. So we're really excited for the year that we've got ahead of us so that we can start to unlock more and more of the healthcare ecosystem. How do we supply them with the information they need to succeed and to do their best jobs?
Well, definitely exciting. And how will this impact current and prospective customers?
That's John's world.
Yeah. More coverage is better for everyone, right? It gives them more signal into their given market. So if we think about existing customers, you will now have access to much more data than you had historically. You were already a leading organization in the space of data collection and being able to illuminate insights through that. Now it's just even more pronounced. So existing customers will have much more data at their fingertips that they can leverage for whatever their use cases are. And prospective customers now have insight into areas that they otherwise wouldn't from other organizations. So whether it is that longitudinal journey, as we mentioned, through a patient's insight, or it's focused on just signal into a given market, we now have that more in spades than we did in the past. So it's more data, it's more analytics at their fingertips, and hopefully more insights that they can drive towards whatever their goals are: cost reduction, patient improvement, et cetera.
And the other thing that really helps on the prospective customer side is oftentimes folks will come to us, and Clarify might be a new name to them, candidly. They've not spent time with us before. They've not heard from our other customers. Providing that class recognition and also the reality that we're the biggest data set in the industry, both of those things together really help. Actually, we were speaking together, John and I were speaking to a prospective customer, and they were saying it was really helpful for their internal discussions to know that, oh, Clarify has been ranked by class as #1. That helps bounds for them to justify internally, Clarify is the best. And that's what we've always wanted to be, and we're extremely excited to be here.
Thank you guys so much, and folks, a lot to be proud of at this time at Clarify Health. Look, there's a lot going on with the No Surprises Act, price transparency, and from what I understand, there's something big developing in July of this year. Do you guys want to tell us a little bit more about that and what our listeners and viewers should keep in mind?
Sure. So for everyone that's obviously aware of this data, we've been plagued by inaccuracies or incomplete data within the market, right? Whether it's hospitals or health plans, we've struggled to get the most accurate information across the board, which has impacted folks' ability to use that data to drive meaningful insights as it relates to contractual negotiations. So on the 1st of July, we're going to be rolling out, CMS is going to be rolling out more standardized templates for how you can be populating your price transparency information from a hospital angle. And we're really hoping, and we started to see this already with some files, the standardization will lead to better data quality, which will allow for us to make use of the data in a different and kind way than we've been able to in the past. So as of 1/1, some organizations have already started to comply, and you can start to see in their files are fitting the structure that we want to see, which is fantastic. And the data quality has already started to jump. But at the end of the day, we want to make sure that an organization can compare themselves to their competitors, understand where there's opportunity, and really drive better rates for their hospitals, or the inverse from a health plan perspective as well.
Yeah, if we can reduce the variability in how folks are posting the information, it just makes it so much easier for you to read it on the other side, get quick access to the tape. So we're excited about being able to pull this data so much more quickly and get it to our customers as quickly as possible in the most standardized format. One of the other things that's cool is that we actually have some prospective customers now reaching out to us to say, hey, Clarify, can you help us with posting the data? And we're starting to have more and more of those conversations. So lots coming. We're excited for the year ahead, and we'll see where things go.
Well, very exciting. Thank you both. And for everybody listening and viewing today, these are real issues that you're grappling with. You don't have to deal with them alone. So make sure you check out the show notes for best ways to get in touch and find out more about how you can make the most out of Clarify Health solutions. Thank you guys for being with us today.
Thank you so much.
Yeah. Thanks all.